Good afternoon to you.
Good afternoon to you.
Good afternoon, and thank you for being here today. Today from the Department of Public Health, I have Dr. Cantor, and you're familiar with him. But we also have Dr. Amanda Logue, who is the Senior Vice President and CMO of Lafayette General Hospital, and Dr. Henry Kaufman, who is the CMO of Our Lady of Lourdes in Lafayette. Dr. Logue and Dr. Kaufman represent the two biggest health systems of the Acadiana region, and they're each going to speak to you in a few moments about what they're seeing in their hospitals. You all undoubtedly are aware that we posted some big numbers yesterday, and unfortunately the numbers today are not much better. Today we are reporting 2,408 new cases, which means that the state has surpassed 100,000 cases, and in fact we're at 101,650. Of course, these are only the cases that we know about. These are all cases where we have a positive test result. There are undoubtedly more because there are individuals who haven't been tested, even if they've been symptomatic, and we know that somewhere between 25 and 40% of people with COVID-19 are asymptomatic, remain asymptomatic, and very few of them actually test. So we know there's a lot more COVID out there than just those who test positive. Sadly, we are reporting 16 additional deaths today. That brings us to a total of 3,574. Yesterday, we reported 60 new deaths. That was the highest daily number since May. And we do know that sometimes the numbers of deaths they lag behind other numbers. But I will tell you, no matter how you slice it up, these death numbers are very, very troubling. We have now almost 1,175,000 tests overall. And in the month of July, we have reported 446,000 tests. The monthly goal, as you probably know, is 200,000. And so we have greatly expanded our testing here in Louisiana. I believe that we are number 2 in the country in per capita testing overall. And in the month of July, with the additional tests, we are number 1. And testing is really important because it helps us to know what we are dealing with. And what we're dealing with is a very serious problem, a widespread problem with a high prevalence of COVID-19 in every community across the state of Louisiana. We all hear these numbers daily, and sometimes you run the risk, and one of the fears that I have is people just become accustomed to hearing the numbers and they don't really think about them, and they stop paying attention. But when you hit certain milestones like we hit with going over 100,000 cases and the deaths and so forth, I just do hope that people are taking that very seriously and that it serves as a reality check that we in fact are in a public health emergency, not just one that has been declared by myself. COVID-19, as I mentioned, is prevalent throughout our state. It is more widespread than ever before, and that is why we are remaining in phase 2. I mentioned that earlier this week. I will soon sign a new proclamation that will become effective tomorrow. It remains in place until Friday, August the 7th, and not only are we staying in phase 2, but that will include a continuation of the statewide mask mandate, the limitations on bars that won't be open for on-premises consumption, and the 50% crowd size limitation for social gatherings. Those will be continued. We're certainly not where we want to be in Louisiana. And, you know, we don't want to have to go backwards in terms of going back to phase 1 or to phase 0. But what we absolutely cannot have happen here is that we lose our capacity to deliver life-saving health care in our hospitals. And that's why these mitigation measures are in place. That's why the restrictions that we have are in place. And we have every reason to believe, based on experiences in other countries and modeling done here in Louisiana, that if we can get universal compliance with masking or other face coverings, social distancing, washing your hands, staying home when you're sick, just cut down on your travel, stay home more often, and so forth, that we can actually flatten the curve, get back on top of the numbers without having to go back into phase 1 or to phase 0. You will recall that when I first announced the statewide mask mandate on Saturday, the 11th of July, there were 3 parishes who met the criterion to opt out of the mandate. And that criterion is to not have a high incidence rate as defined by the CDC of COVID-19. And so any parish that was below 100 cases per 100,000 residents for the most recent 2-week period could opt out. As of LDH data that we have today, there are no parishes in the state of Louisiana who are in that category. Every one of our 64 parishes has a high incidence now of COVID-19, meaning more than 100 cases per 100,000 residents over a 14-day period. What worries me most is the toll that the latest resurgence has taken on our capacity to deliver health care, and the impact that that's having on our healthcare professionals, our doctors and nurses and respiratory therapists, and all the way down to EMTs and paramedics and everybody in between, all of whom have performed heroically now for many, many months. And this resurgence is taking a toll on our hospitals and on those individuals. As evidence of this, Our Lady of the Lake Hospital here in Baton Rouge in Region 2 has put its main campus on a course where it will take a 2-week pause in performing non-emergency medical procedures that require inpatient beds. And that's to make sure that it has the beds that it will need for COVID-19 patients. And not just the beds, so that it will have the staff. And there are hospitals all across the state of Louisiana who are making these decisions, and I think you're going to hear more about that in just a moment. Hospitalizations are increasing all across the state of Louisiana. There's not a single one of our 9 regions where they're decreasing, but we are especially concerned today about regions 4, 5, and 6. 4 is the Lafayette area, 5 is the Lake Charles area, and 6 is the central Louisiana area around Alexandria. That is why we have the doctors here who are going to talk to you in just a moment. But because you've heard me and you've heard Dr. Cantor and you've heard Dr. BU, but we're concerned enough about what we're seeing. We've asked the chief medical officers of the 2 biggest health systems in Acadiana to come and explain what they're seeing on the ground at their hospitals. And so at this time, I'm going to ask them to come up and deliver their remarks. And we're going to start with Dr. Logue, and then Dr. Kaufman will come up after that. And they will be available for questions as well.
Thank you, Governor Edwards, for allowing us to be here and share our story. I'm privileged to be here with Dr. Kaufman and really give you an impression of what's happening within Acadiana as it's severely impacting our hospital resources. Lafayette General Health is the largest healthcare provider in Region 4. We're very accustomed to taking care of community patients throughout Acadiana, bringing them in, having them in our system, taking transfers. But with the volume that we're seeing of COVID-19 cases, we are not able to do that as routinely as we would like. It's become a real challenge for us to take care of even our own community, let alone expand our services outside. We are actively taking care of the patients and surging as we need to, but we're quickly running out of space. In the last month, we've had to transfer patients out of our health system to Rapides, Baton Rouge, North Louisiana, even as far as Mississippi, as we didn't have any space to take care of them. Not only that, but in the month of July only, we've had to decline 87% of the requests of transfers into our health system. That's not normal for us. We are happy to take care of anybody that needs a higher level of care and come into our health system, but we have not had the capability to have space for them. That being said, I want to be sure that if anybody needs emergency care, you need to come to the emergency room. We will take care of you. We will stabilize you. We will do everything that is needed, that is medically necessary for you. So I don't want anybody to be afraid that they can't come seek medical services because the hospital is too full. We are dedicated to taking care of you if you need us. At our main campus, which is our largest hospital, Lafayette General Medical Center, 1/2 of our ICU currently and 1/3 of our non-ICU beds have patients that are fighting COVID-19 currently. On May 27th, for a little perspective, we had 15 COVID-19 patients at LGMC, and yesterday morning we had 105. In our whole five acute hospital system, we have had 143 COVID patients. That number was only 20 just 6 weeks ago. So we are certainly seeing a rapid increase in community spread of COVID, but what that leads to is hospitalizations that follow the community spread. And that is part of our plea to Acadiana today and elsewhere, is to understand the impact of widespread community outbreaks leads to impacts into the health system. Governor Edwards mentioned the deferring of elective surgeries. We are absolutely moving elective surgeries that we do not have the capacity for off of our main campus and canceling some altogether. This is the last thing we want to do at this time frame because we had to do this back in April. And so some of those patients are still waiting for surgery to get done now, and we are unfortunately having to put them off again. We will do all emergency surgeries that are necessary. We certainly have the capacity for that, and we'll continue that. But our hospitals are full, and our ICU is full. Some of our beds are unfortunately closed because of illnesses to our staff. So we've had we don't have enough nurses to staff all of our beds right now. We are so thankful for the dedication that our nurses and our doctors and all of the bedside team is putting towards taking care of these patients, but the level of intensity at which they're working right now, we know is not going to be sustained. So we have to be able to give them a break. They have been wonderful, and we know they are very tired, and some of them are getting sick as well, too. COVID-19 has not replaced the typical volume of patients that we have: heart attacks, strokes, car accidents, emergency surgeries. All of that volume continues in the community, and we want to take care of that. But when you add on this level of volume of COVID on top of that, it's really unsustainable for us. We can, under normal circumstances, absolutely take care of both types of patients, patients that need our help from a COVID illness or from the typical emergency and medical procedures that they need, but not when we have surges to this degree. The only way to really prevent these recurring surges that are happening is to truly flatten the curve once and for all. So I'm really here to urge everyone in Acadiana and elsewhere in the state, you need to follow the guidelines that we have asked. Washing your hands, physically distancing from one another 6 feet or more away, avoiding large crowds, and of course, wearing your mask when you leave the house. And especially if you're over the age of 65 or have chronic illnesses such as hypertension, diabetes, chronic kidney disease, or immunosuppression, you need to be especially careful and consider staying home if you don't have to be out. A COVID-19 unit is really not where you want to be, and we don't want to have to admit any other people there. So I urge you once again, just please do your part to flatten the curve. It's time for us to really understand that it's impacting COVID patients, but it's also impacting everybody else who wants to seek care in Acadiana, and we want to continue to be there for them. Thank you.
You're welcome. Thank you, Governor Edwards. I would echo Amanda Logue's sentiments. At Our Lady Lourdes Regional Medical Center, our hospital is full. Our ICU is near complete capacity. This has significantly affected our normal operations. For 2 weeks now, we have almost completely eliminated all elective surgeries at the hospital. This doesn't just mean a simple hernia repair or maybe a knee replacement that's been scheduled for 6 months. This means that if your cardiologist has recommended that you undergo a heart bypass, that is not going to happen right now. It may mean that if you have an early stage cancer, that operation is going to be deferred. My other hat, my other job that I wear when I'm not in my administrative role as Chief Medical Officer is as a surgical oncologist administering to the people in our community. I am still dealing with the aftermath of people presenting with later stages of disease during our first wave of COVID cases where we had to delay elective surgeries to make room for our COVID patients. People were presenting with later stages of disease. I have women who weren't able to get their mammogram during the first wave and finally were able to get it and likely presented with a later stage of disease than they would have otherwise. In talking to my breast radiology colleagues, because of the changes that have occurred, we have hundreds, if not thousands, of women in the community who haven't been able to yet get their mammograms. I worry that there's a hidden impact of this disease on our citizens in our community, completely unrelated to COVID, that we haven't yet fully appreciated. It is a real and present danger, not only because of the primary effects of COVID and becoming sick, but also because of the secondary effects and how it affects our hospitals and our community. Our physicians and our team members on the front line are doing an amazing job. They're getting up every day. They know they're going to have to go into a COVID unit. They're going to have to put on full PPE all day long. They're going to be uncomfortable. They're going to subject themselves and when they get home, potentially their families at risk. They're tired. They were tired from the first wave and maybe not completely recovered when we've seen this second wave with over a 300% increase in the number of cases that we saw with our first wave in Acadiana. It's a very real problem. Burnout of our team members is a real problem. Fatigue is an issue. We want to be strong and there for you and there for our community, but this current wave of cases is taxing our ability to do that. I anticipated that we would have a second wave, but I didn't think the wave was going to come this soon. I thought this wave was going to hit us in the fall. I thought we'd have more time to prepare, and I thought we'd be in a better place, and unfortunately we're not. So I would advocate in the strongest possible way that our community realize how compelling of an issue and how compelling of a danger this is, not only to those who get infected, but to the community in general and those seeking care for other needs. COVID is not an illness which is only going to affect those at high risk. And I've heard that from so many people. We have 19 and 20-year-old healthy kids in our ICU right now without other comorbidities. We're seeing an increase in 40 and 50-year-olds without significant comorbidities in our ICU being critically ill. It's a very real problem. We can't predict now who it's going to affect in a severe way. Fortunately, it doesn't affect most people, but at the great increase in the number of people that we're seeing right now, it is a very real problem. So please, I would advocate, again, all our members of the community, be smart, social distancing, wear your mask, good hygiene, don't gather in large crowds, don't subject yourself to unnecessary risk. If we do the right thing, we can get through this. I think there's really good data to support that, but it's going to require work on everybody's part. Thank you.
So thank you, Dr. Logue and Dr. Kaufman, and we appreciate you being here today. We appreciate your tireless efforts and that of all the healthcare workers around the state, all of whom are absolute heroes in our eyes. We're grateful for the work that you all do every day. I think this is a good time to let folks know, here in Baton Rouge especially, we've got a new surge testing site in downtown Baton Rouge at the Welcome Center here in the capital area. It is free. It's open today. It'll be open tomorrow, and it'll be open on Monday the 27th from 7:30 to 5:30 p.m. I especially encourage people who work downtown, including all of our state workers, to take advantage of this convenient testing opportunity. And I will remind you that you can test whether you have symptoms or not, whether you've been in contact with someone who has COVID-19 or not. I took advantage of this opportunity today on my way back to the Capitol from GOSEP. I can tell you it was easy, it was quick, and I appreciate everyone working to make this service available, from our public health employees and the Louisiana National Guard to our private sector healthcare partners. And I also appreciate the partners we have on the White House Coronavirus Task Force. They were the ones who put this surge testing in Louisiana at a time when they were only putting it in 3 states. Texas, Florida, and Louisiana. And we are working now to establish an additional surge testing site in the New Orleans area, and I hope to have more information to you all on that in the very near future. You can pre-register. It's not necessary, but you can pre-register for a test at these surge sites, and you go to doineedacovid19test.com. doineedacovid19test.com. I just want to take a moment and do something that I really shouldn't have to do, but I think it's imperative. Unfortunately, it appears that there's a deliberate misinformation campaign claiming that the state's inflating cases by counting people multiple times if they take multiple tests, and that just isn't the case. As Dr. Bu mentioned the other day, a case refers to a specific individual, whether that individual tested positive once, twice, 3 times, or whatever. And so I don't want anybody to believe that the data is inaccurate or being manipulated, and it is grossly irresponsible for people to be spreading misinformation about that to try to minimize how serious this situation is. And we all know that if you have COVID-19 in your state, in your community, that's going to show up testing first, hospitalization second, and deaths third. There's no way the hospitalizations are going up and the deaths are going up and the cases aren't going up with them. It just doesn't make sense. And so we have some people out there who are being irresponsible, and so I'm asking them to stop, but nobody should be paying attention to what any of those individuals are saying. And I'm not telling you we are perfect, but I'm telling you we're working extremely hard. And we have put in multiple redundant systems to scrub the data and make sure that it's accurate and that it's timely. And we are sharing it with the public in a way so that we can be as transparent as possible. I am encouraged today. We have some serious numbers, cases, hospitalizations, deaths that are very troubling. But I am encouraged by the vast majority of businesses, local leaders, and residents who are in fact taking this seriously, and they're being responsible. They're masking up to protect their loved ones, their employees, their communities, and the state of Louisiana, and trying to make sure that we get back on top of this virus and those numbers just as soon as we possibly can. We are at a critical point, which is why I'm asking everyone to take this virus seriously, and everyone needs to do his or her part. I don't want to go back to phase 1. You don't want to go back to phase 1. It shouldn't be necessary to go backwards. But the only thing that's going to keep us from doing that is have everybody wear a mask when you're outside your home. It's a small price to pay. And it is being a good neighbor to others, and it is being considerate and courteous if to nobody else, to our healthcare workers who are being inundated with patients and who are working so valiantly under difficult circumstances for months on end and exposing themselves to this virus by definition of the nature of the work that they're doing. There's some other things that you can do that would be very helpful. Remember that there is not a safer place for you than at home. When you go out, do it as infrequently as necessary. And I've said this before, but you don't need to go to the grocery store 3 times a week. Go once. And when you go, you don't need to bring the entire family. If everybody will just take these common sense steps, then the interaction, the contact between people will be decreased. And obviously, that is how the virus spreads. And if when you do go out, you practice social distancing, you're masking, you're washing your hands frequently, and certainly you never go out when you're sick, and you never go to work when you're sick. We're going to turn this around, and I'm optimistic that we're going to do that. Final word about the weather before I take questions. We are continuing to closely watch the tropics. You know, we're in hurricane season. Tropical Depression 8 is slowly moving across the Gulf of Mexico now. It is moving towards Texas, but there will be impacts in Louisiana. There's a risk of heavy rainfall later today and tomorrow in the south, southwestern, and even in the central parts of our state. The National Weather Service has placed most of southeast Louisiana in marginal risk for excessive rainfall. That threat is higher for areas south of the I-10, I-12 corridor, and flash flooding is a concern across the region. In southwest Louisiana, the National Weather Service says areas south of I-10 could receive 2 to 4 inches of rain between now and Sunday. Tides are running higher than normal as well. And I would just encourage everybody, if there's flash flooding and you are out there driving, please don't drive on any road that is underwater unless you are absolutely 100% sure that it is safe to do so. We're going to continue to monitor Tropical Storm Gonzalo, which is forecasted to become a hurricane later tonight. It is still well out in the Atlantic and a long ways off, but it merits our attention now. And with all of these storms that we're talking about, and it being the end of July now, if you haven't prepared yourself and your family for a hurricane, you need to do that. Go to getagameplan.org. And preparing for a hurricane today for you and your family is different and a little more involved than it normally is because of the public health emergency that we are in. So I encourage everyone, even if you've done it before in previous years, go to getagameplan.org so that you can be prepared. Next week, we'll be back with press conferences on Tuesday and Thursday here at the Capitol. Obviously, if circumstances warrant, whether it's the weather, COVID-19, or anything else, we will let you know if we're going to schedule additional press briefings beyond those on Tuesday and Thursday. With that, I'm going to take your question and remind you we have Dr. Lowe, Dr. Kaufman, and Dr. Canner who are going to be able to take your questions as well. Yes, sir.
Governor, you said even today that you won't let the state get to a point where it's threatening its ability to deliver health care. It sounds like we're almost at that point, and it's not just in Lafayette, it's in Baton Rouge, Our Lady, Lake Charles,
Yeah.
We're saying the same thing. Early on in the pandemic, when it appeared we were getting to this point, you spent hundreds of millions of dollars to build the Memorial Convention Center and reached out for ventilators and stuff. I know we have enough ventilators now, but what's the plan if when you run out of space? Is it just to ship patients to Memorial, or is there another plan in place to deal with this surge of the
Well, first of all, we're going to make sure that that doesn't happen, that we don't have the capacity to deliver health care. Secondly, I would tell you that we still have 250 beds at the Memorial Convention Center, and we have staffing today for 60 of those beds. I think 28 of them are actually filled. Within a week's time or so, we can have staffing for another 60 beds, and we can build with a staffing contract that we have in place in that fashion as we need to. Further, much of the investments that we made early on in the March-April timeframe created new permanent capacity, surge capacity for ICUs and surge beds at various hospitals around the state. And so we're in better shape as that goes. Quite frankly, my bigger concern today in Louisiana is not so much about beds as it is about staffing. Because we believe that we will be able to make the adjustments necessary and open up these surge units. And for example, if we need to, we've got a couple hundred beds that are not ICU beds, but we've created a negative pressure environment so they can be converted into ICU beds if we need them. And that's just in one of our hospital systems with Children's Hospital in New Orleans. The bigger challenge is going to be around staffing. And the reason it's bigger this time is because just like COVID-19 and this surge that we're seeing in cases around the state is in all parts of the state, it's also happening in multiple parts of the country all at one time. And so it's hard to draw on staffing from other parts of the country because they're unwilling to give up their staff, and for good reason. So that's the bigger challenge we have right now. We have worked. This is one of the things we met extensively with the Vice President about last week after that meeting. In fact, we had started working on it with a call with the hospital CEOs and medical directors the week before. And before the Vice President ever came, we were meeting with the hospitals trying to figure out how much staffing we should request. We met with the Vice President about that. He encouraged us to get the request in through FEMA. We have done that. We are now working with the federal government to try to get some help on staffing, and we're looking at other things we can do here in Louisiana using the existing footprint of our hospitals. Because if you've got staffing challenges, they're exacerbated if you try to open a facility that is not part of an existing footprint. We do have the Memorial Convention Centers we talked about, and right now we don't plan to create new facilities outside of our existing hospitals, but we are working to solve the staffing shortages that we see there. And, yeah, go ahead.
How many staff members have you asked for in FEMA?
I don't have that request with me. I want, as best I can recall, it's about 300. I'll get the, and by the way, that ranges from everything from a phlebotomist to a respiratory therapist to an ICU nurse, other nurses and doctors and so forth. But if you added it all up together, I think it was about 300, but I'll get you that information. Any other questions? Are y'all really going to let me out of here with one question? Here you go.
Hey, in the last scenario, we've heard from so many of our viewers that they feel like in the Acadiana region, and Lafayette in particular, when it comes to enforcement of wearing a mask, that the local agencies and parish government, that they're not doing their part to help enforce that. What can we do on the state level to really drive home how important it is for people to wear masks, social distance, and to follow your name?
Yeah. Well, you know, when you watch people like Dr. Tony Fauci and Dr. Birx speak, when you see what's coming out of the CDC and looking at Dr. Redfield, and you see all the medical professionals around the country, and we had two of them here today that spoke to you about the importance of all of these measures: masking, social distancing, washing your hands, staying home with your sick. When you see all of that, and when you accompany it with the numbers that we're experiencing here in Louisiana right now, both cases, but also hospitalizations, deaths, you would think and you would hope, obviously, that the people would be responsible enough to just look at that, take it into consideration, and decide, you know what, I'm gonna comply. I'm gonna do what I'm being asked to do because it's really important. It's important for those who are out there who are vulnerable. It's important for the medical community. It's really important for everybody. And I want to remind you, and I think Dr. Logue said this perfectly a while ago, even if for some strange reason that is totally incomprehensible to me, you don't care about COVID-19, you should care about there being capacity at that hospital when you have your automobile accident, or when you have your heart attack, or your stroke, or your mother or grandmother has has that stroke or whatever, because we're talking about the same staff and the same beds all over the state of Louisiana. So for all of those reasons, we just need people to focus on the task at hand, do their part, be good neighbors. And I've said this from the beginning, it's not that we won't enforce these things, but if the people of Louisiana are going to make us enforce all of this, then we're not going to be successful. There are 4.6 million people in Louisiana, tens of thousands of businesses. If the people of Louisiana are going to sit back and say, well, we're going to make you enforce every bit of this because we're not going to voluntarily comply, then we are doomed. Now, that is not the case. And as I mentioned, the vast majority of businesses and people are being responsible. But I think we all know there's still too many who are not. And so I'm directing these comments at those individuals. And look, if you want to be mad at me, be mad at me. If you want to disagree with me, disagree with me. But be mad at me and disagree with me with a mask on when you're outside your house. Yes, ma'am.
Governor, you talked about the deliberate misinformation campaign. Where do you think that stems from? Have you all tried to track down? I know I've seen a lot of it on social media.
Yeah.
And obviously it is being transmitted that way. Have you all tried to track down who has started it and if there are bots promoting it? It looks like some of it is bots on Twitter.
Yeah. I don't know. I'm not personally out there investigating it. I'm aware of it. I'm trying to do what I can to make sure that nobody attaches any credibility to that. This is not just happening in Louisiana. I mean, look at California and Arizona and Texas and Florida and all the other states right now that are having this tremendous resurgence. Nobody's out there cooking the books. And, you know, I guess one of the things we could do, if it were safe to do it, is we could open our hospitals up and just have these people file through the hospital and look in these rooms at these people with COVID-19 who are attached to a mechanical ventilator fighting for their life. They would know that that's not some sort of a hoax or some made-up number. It's just grossly reckless and irresponsible. And so I'm asking people not to do it, and I'm asking other people not to believe it. Yes, sir.
In your latest mandate, we have that restriction in place on bars.
Yes.
When it comes to outbreak settings, is it surprising to see that bars are the #1 outbreak with the second highest number of cases?
No, well, I can't say that I'm surprised because if you'll remember, bars were about the last things that were opened. And that's because we knew that the environment of a bar it's just very difficult to operate safely. And it's just the nature of what people do in bars. Unlike a restaurant where you might be intending to be there for 30 minutes, 45 minutes, or an hour, grab a meal, and leave, many people go to the bar intending to be there for several hours. They're going to have more than one drink. Their inhibitions are relaxed, and they might have had one mindset going in, and that mindset changes. And, you know, as I've said before, there's often music playing, and so if you want to be heard, you got to speak loudly. When you do that, you pull more air out of your lungs, and you're emitting more COVID-19 particles if you happen to have COVID-19. And then if you're on the receiving end of the conversation and you want to hear somebody, you get closer than you probably should be because you still have to overcome that same issue with the background noise. And it's just ultimately it's just a very difficult environment to do safely. You know, we were hopeful that with the restrictions we put in place that made them operate at a reduced capacity and telling the individuals had to remain seated and so forth. But it just, for the vast majority of bars out there, it just proved to be too much. And so that's why they're closed again. And by the way, that's not just here in Louisiana. That's a White House Coronavirus Task Force recommendation for our state and other states because they are seeing the same thing. And it's not just in the United States of America either. It's all over the world. And you can remember right after South Korea came out of their lockdown within a couple of weeks, they had to shut every bar and soul down because they had a very similar experience. Yes, sir.
I have a question for either one of the doctors.
Well, whichever one of you feeling really good, come on up and answer the question.
Yeah, Dr. Kaufman is great. I'm wondering if you can talk about, so it seems like the staffing issue is really what, when you talk about healthcare capacity right now, I'm wondering if the Morial Convention Center is a viable option for you to send patients from your hospital, or are there challenges? I know other hospitals have talked about challenges with the acuity level of these patients, shipping them on a 2-3 hour drive to New Orleans. But can you talk about whether that's an option, and if so, would you plan on doing that, or another route for shipping patients?
So we have physical space. We have beds that are used during the day traditionally for outpatient surgeries, taking those patients in, seeing them. Those can be converted into hospital rooms. We have beds that are traditionally used for other purposes that we've now converted to rooms. What our problem is as we're seeing an increasing number of transmissible cases in the community, we're seeing our nurses get infected from community spread. Our nurses, our CNAs, our care providers, and some of our physicians. When a nurse becomes infected, the quickest she or he is going to return to work is about 10 days. And on average, it's a little bit longer than that. As a result, there's a huge pool of nurses that we have out right now. That puts a strain on the nurses that are currently there. It puts a strain on staffing in the hospital. And the one thing that is actively going on during the day is looking at where the patients are, what our staffing for our next shift is, and how we're going to accommodate that. So far, it's working out. The patients, our nurses, our team members are tired. The problem is not having physical space, like needing somewhere like the Morial Convention Center necessarily. It's having enough people in our community to staff those beds to keep our nurses healthy. One way that you keep from getting COVID is that you stay active and healthy and take care of yourself, and that you're well rested and that your immune system's working well. The nurses and the physicians and our staff members taking care of these people are tired, and they're not taking as good a care of themselves as they need, and that's a vicious cycle. And so to reiterate, the physical space is there. The problem is staffing. Everybody's looking for staff right now. We're not quite at the point of reaching out to non-traditional areas for staffing, but it's at least been discussed and talked about calling in maybe some of our retired nurses, maybe some of our nurses who have gone on to other careers who still hold their nursing license. And in fact, I would take the opportunity and say, if there are nurses out there who still hold their license and want to help, I promise you your community hospital could use your help right now, and they'd be more than happy to have you. And your colleagues would be more than happy to have you as well. Yes, sir.
I know, the governor had mentioned how this is such a nationwide problem, so it would be a challenge to pull nurses from other states. But do you foresee that being an option for you all at Our Lady of Lourdes or even Lafayette General Health to reach out to try and attract some people from out of state to help out?
Right. So one of the first things that we've all done is contact local staffing agencies, but which is a traditional way of flexing up your staffing in the hospital. There just aren't a lot of people available right now. Everybody who's employable is employed. Everybody across the country is seeking using nursing right now. So there haven't been many stones that have been unturned in regards to how do we build up that nursing pool. And so, yes, we have considered all those.
To further demonstrate the challenges around staffing, I've had requests to take the National Guard soldiers in a medical unit and make them available at our hospitals. But guess where our nurses who are National Guard soldiers work? They work in our hospitals. So I would be pulling them from some hospitals to send them somewhere else when we have problems around the state. To further illustrate this, the first thing FEMA told us to do when we made the request last week was to put out what we call an EMAC request, where we send a request to all the other states with our particular needs around staffing to see if there's a state out there that will say, yeah, we'll volunteer and we're going to send you some of what you need. So we did that. Early last week, we put out an EMAC request for our staffing needs that we had developed by talking to our medical directors. You might not be surprised, but exactly 0 states offered any staffing. So then you start looking at the entities out there who engage in contracting for staff, and we're working that angle now, but that will be difficult as well, and so that's why we continue to work with FEMA on staffing. And with Sam, with regard to your question about the Memorial Convention Center, remember that facility is for the less acute patients, and it's there in order to allow hospitals to free up their beds sooner than they otherwise would, so that once a patient reaches a level of recovery that means that they don't need that acute care bed, but they're not ready to go home, we can take them in the Memorial Convention Center. They can turn that bed over quicker, and so that's how it would help. And so certainly, as we continue to operate the Memorial Convention Center, if they get patients who have recovered enough that they don't need a hospital bed in their facility, send them to the Memorial Convention Center is something that we can certainly consider. Yes, ma'am.
Governor, with the testing shortage issue in terms of the turnaround.
It's not. I want to just be clear because I know you just said about a testing shortage. We're doing an extraordinary number of tests, and we're not short on the collection kits, the swab and the viral transport medium. That's where we were a couple of months ago. There are some reagent issues at the labs that are contributing to a longer turnaround time, and I think the sheer volume of tests that are being sent out to commercial labs is creating an issue. And so we do have, for example, of all the tests that we were reporting today, 65% of those were within the last week. 30% were in the week before that. So that gives you an idea of the percentage of tests and how they are. And by the way, this greatly impacts our ability to fight COVID-19, because if someone waits 7-10 days to find out that they're positive, if they didn't know that they were positive and curtail their activities and isolate, even if they were asymptomatic or barely symptomatic, we know they're contagious and they're out there spreading that disease. The other thing that happens is if it takes too long to get a test result back, the contact tracing is very hard, because we want to be able to catch people early. And so the turnaround time at the labs is what the challenge is presently. It's not the number of tests that we're doing so much or the actual testing supplies.
Well, and that's what I was going to ask in terms of the turnaround time. Is that creating any problems with the ability to continually test residents and staff at nursing homes and isolate people as needed in congregate settings?
Yeah, well, obviously, you want the shortest possible turnaround time everywhere. That includes in the congregate settings. We are testing every 2 weeks, 100% of our residents and staff at our nursing homes, including our war veterans homes. And we are seeing some delays in getting those test results back. And anytime you see that, it does interfere with your ability to quickly get on top of a situation and make sure that you are quarantining or a particular patient, if it's a patient, or moving them to that part of the facility that is housing only COVID patients as a way to promote safety and minimize the spread and so forth. But it's also true for the staff member. And remember, the staff member's going home at night. And interacting with his or her family as well. So that is an issue. It's one of the reasons why we are very interested in the proposal that Admiral Giroir mentioned last week on his visit here, and that is that over the next number of weeks, and I really don't know whether we're talking 8 weeks, 12 weeks, whatever it's going to be, the goal is for the federal government to send a point-of-care test machine to every nursing home in the country, including those here in Louisiana, and they're going to prioritize those that are in communities that are particularly in hotspots. And so I think we're starting to see those machines arrive, those testing machines arrive in very small numbers this week, and that's going to continue. But these are point-of-care tests so that the test can be administered, the results will be known within 24 hours at the home. Now, that sounds too good to be true, and so we got to make sure that the machines come and that we have all the necessary testing materials that we need to make them work and so forth. But we're excited about the opportunity we're going to have to do that. Yes, sir.
Governor, a viewer reached out to me just a minute ago and asked if you could explain your reasoning behind keeping casinos open at this time.
Yes, so we have, I'm not going to tell you we haven't experienced any issues at casinos, but I can tell you that overall they have been few in number and much more easily remedied because you only have a very small number of them operating. Secondly, it's the most regulated business environment in the state of Louisiana. And so when you go in there and you tell them, look, you're not supposed to have these two machines, gaming stations operating simultaneously if they're contiguous to one another. As soon as you point those things out, the corrections get made. And we know that they have been very responsive to any remedial measures that we tell them that they need to take and so forth. And so that's why they are open. We believe that they can safely operate at the levels of occupancy and gaming positions that we have prescribed, and with all of the different precautionary measures that they are taking, many of which were required of them. Others, they've stepped up and said, we're going to go beyond that and actually do more. So that's why they are open. We want as much of our economy open as possible, consistent with public safety and the health of our people. So where we can operate a business safely, we want to do that. And I will just tell you that under the limitations and restrictions, the protocols we have in place with casinos, they can operate safely. Thank you very much again for covering this afternoon. I do want to encourage the people of Louisiana. I want to remind you, we've been in a very bad place before with COVID-19. We're in a very difficult place now. But we flattened the curve once before. We can do it again. And we can do it without going back to a shelter at home. We can do it without going back to phase one. But it really is going to take everybody. And so if you want as many businesses open as possible, with as few restrictions as possible, if you want as many employees back at work as possible and be free to go out and shop, that day will come sooner. And there will be less cases, less hospitalizations, and less deaths between now and then, if we will all do our part. And so again, I'm encouraging you, please wear your mask. Social distance. Make sure you stay home when you're sick. Wash your hands frequently. All of those things. And please watch out for those out there who are the most vulnerable. And for everyone, the safest place to be is at home. And for those who are most vulnerable to this disease, that is especially true. And let's remember to lift one another up in prayer. Let's be thankful for the blessings we have, and sometimes it's hard to do that when you're so focused on the challenges that you see in front of you, and it's hard to lose sight of the blessings. But we had a couple doctors here today to speak that represent the entire medical community, and they certainly have been a blessing to us here in Louisiana and will continue to be. So let's, if nothing else, be thankful for them. And I will see you back here on Tuesday. Have a good weekend, everybody. Have a safe weekend, everybody. God bless.